more people die annually in the United States due to gun-related causes than in any other high-income country. The United States also has more civilian-owned gun deaths than anywhere else. Dr. Ranney, why do we need a public health approach to this issue?
So as I said in the clip that was shown as we were walking up, the reason for a public health approach is twofold. The first is that firearm injury is inherently a health problem. Yes, the criminal justice system gets involved. Yes, the political system gets involved. But at the end of the day, the reason that we care is because when a trigger is pulled, it hurts people. It may hurt them physically because they are shot and survive, because they experience disability, or because they die. It may hurt them emotionally, even if the bullet never touches them, sometimes even if they're not even standing in the place where the bullet was released. So that is the first reason that we care about it as a public health problem, is because of its inherent health effects on the human body, the human mind, and on human society. The second reason is because the public health approach allows us to prevent it before it happens. When I'm working as a physician, I am treating something that has already occurred. In contrast, when I take the public health approach, I'm going upstream to try to stop that trigger from ever being pulled. And the amazing thing about the public health approach is that it is this standard discipline. It's a standard 4-step scientific approach that when we apply it, it works. It's worked to decrease car crash deaths by over 70% across the United States over the last 50-odd years, despite there being more cars on the road. It's worked to stop deaths from HIV and AIDS, despite the fact that we have not stopped people from having sex or using drugs, right? And it, of course, worked to decrease COVID deaths, although there was a lot of debate about some of the measures that we used, just as there is some debate around some of the measures that we use to reduce gun deaths. But again, the gorgeous thing about the public health approach is that it gives us tools to approach those questions, to assess the accuracy of whether or not an intervention will work, and then to scale up the solutions that are most likely to make a difference in a particular community or state or culture.